Welcome to a BTR News commentary. My name is Scotty Reed. Please continue to support the nonprofit media operations of the Black Talk Media Project. You can make your donations via PayPal, even without a PayPal account, by going to blacktalkradionetwork.com. Recently voted the number one platform for Black digital radio and podcasting. Totally grassroots operation, and your donations are tax deductible. Let's talk about a human rights story. One of the most famous human rights activists, as well as being a political prisoner, Mumia Abu-Jamal. I mean, this man is probably the most recognized political prisoner around the world, and he has a lot of things going on behind the bars. As you can see, there are some stories related to saving his eyesight and also to demand his release. That's coming from the San Francisco Bay View. Also, NPR was reporting that Mumia Abu-Jamal was granted the right of appeal after spending decades in prison. Now, he also has a federal lawsuit concerning access to medication to treat a disease that he contracted while in prison. And he has a lawsuit working its way through the federal courts, and it was a recent ruling this week that's going to keep that case alive, although he has, in a separate case, been granted access to the drugs or given the drug treatment and cured of his hepatitis C. But he suffered a lot of damage because of that, which is related to his eyesight and why he's losing his eyesight. Adverse effects from having that untreated disease for so long. So news reports have been filed on the Newswire reporting that a federal appeals court is keeping alive his lawsuit, and he's recognized the world over, as I stated, as a political prisoner wrongfully convicted of the 1981 killing of a Philadelphia cop, serving in the police department rife with racism and known for police brutality against non-white people. I mean, if you look up the history and some of the chiefs of the department, is just rife with racism, and especially during the time of Mumia, when he was an activist and journalist out there doing his work on behalf of the people and being a source of accurate information. So his lawsuit, in this particular lawsuit, he's alleging that his rights were violated when he was denied hepatitis C drugs that are a known cure for the disease, which is disproportionately high among prisoners all across the United States. Prisoners are not given access to medication for a number of ailments and diseases. But hepatitis C, I have heard it described by the CDC in pandemic terms when they talk about the thousands upon thousands, possibly millions of people, if they've never been tested for it and they just contracted it. It's just a potential that so many people have been infected in the prisons through this transmittable virus and denied treatment. And they get denied treatment for a number of ailments, like I stated. And a lot of it is because of the privatization of the healthcare in the prisons. And of course, a private company is most in search of profits, and they will practice malpractice against these prisoners because a lot of people have been propagandized to view these people up deserving of mistreatment and having their human rights violated. But his particular lawsuit focuses on constitutional rights. Quick sidebar here: a common myth that I hear in the black community is citing the Taney decision in the Dred Scott versus Ferguson decision, where in the 1850s that judge said that a black man has no rights that a white man is bound to respect, when they ruled against was it Plessy versus Ferguson, and but it's one of those cases. Y'all could correct me in the comments if you would, which case it was, but where Taney wrote that a black man had no rights to be respected. Well, that was in 1850. The Civil War was fought, and certain constitutional amendments were passed granting rights to African Americans. So we do have rights. it's still a racist system, and we will have our rights denied to us based on racism. But those rights still exist. But on top of all of that, we have human rights, which the United States has signed human rights declarations, like, for example, the UN Declaration of Human Rights, which says it abolished slavery in all its forms, but yet the United States still has the 13th Amendment in place, which reserves slavery and involuntary servitude as punishment for crime. And when you view it like that, then you know why these people are so mistreated. Again, the United States has the world's largest prison population. Um, and the vast majority of them are black and brown and poor whites. But so he's saying that his rights were violated, that he was denied the hepatitis C drugs that's a known cure. And the Third U.S. Circuit Court of Appeals, this again is the federal courts, upheld a lower court's decision that Pennsylvania Corrections Department employees were not immune to being sued over their decisions regarding Abu-Jamal's medical treatment. So let's say you got a doctor or a nurse, or this is the medical staff, and you have diagnosed this person with the hepatitis C virus or infection, and you know that there is a treatment for it that will 100% cure it. But again, because you're working in a system that's trying to create profit over people, you do not prescribe based on cost of this drug to treat him. But he has been treated and been cured, but he had to go through the course. But this has wider implications as well. But let me give you a little bit more details about the judge's decision. They ruled that there's sufficient grounds to support Mumia Abu-Jamal's claim that his constitutional rights were violated when he was denied appropriate medical treatment for a non-medical reason, the high cost of drugs. So again, related back to the Taney decision that some of us like to cite as evidence that black people have no rights. As U.S. citizens, we do. And even when you are incarcerated, you are reserved to a second class citizen status, and indeed a slave status. But you still have rights. The fact that you can get a job in there, even though you're getting paid slave wages and they withhold taxes, well, the U.S. government can only tax its citizens. Okay, so they do have certain rights. You just have to fight for those rights in a system that's practicing injustice through the courts and through law. So they ruled that there are sufficient grounds, and the lawsuit. I don't know if the defendants filed an appeal to just drop the case, since he's been treated and cured of that hepatitis C, still with the lasting damage though from it, and they wanted to end it there. But Mumia's lawyers, which I believe is the abolitionist law firm, which is based in Pennsylvania as well, Brent Grody is his longtime attorney, are still pushing the case. And the only reason to do that is because this would have wider implications. Then it's not just about him getting his, so to speak. Some of us, we don't worry about others once we get ours. And so he got his treatment, he got his cure, but he's continuing the lawsuit because he wants other prisoners in prisons and jails all across the United States, again, the world's largest population, and have access to medical treatment, whether that's drugs or procedures or what have you. And the decision to deny them that treatment should not be based on some cost cutting and trying to save money that you don't want to pay. So this intersects with so many issues. Again, why do the drugs cost so much? I was just reading about the Farmer Bro guy. I don't recall his exact name. That's in prison, that was bragging about the AIDS drugs, I believe, and it was something like 1,000% markup or 5,000. It was an exorbitant amount of money, and just how in the United States pharmaceutical companies charge far more. The American public is charged far more for medicines and these drugs than other citizens in other nations and what have you. So this also intersects with why is this treatment for hepatitis C so expensive. Now, also potential impact could be, think about it in this term. This is a public health crisis, or it's certainly putting the public at risk. People getting out of prison with a hepatitis C virus that is a communicable disease, and they give it to their family member, their loved one, their wife, girlfriend, whatever. And then it just spreads. Like, it can spread sexually, but through body fluids. And so, I mean, you're in confined space, and prisons, think about that. It's easily transmittable between prisoners when you are with others in such a confined space. But then those prisoners come home, and they're living in a small space in a house with other people, or they're working with other people, and then other people in the community at large contract hepatitis C. So I don't think enough coverage is given to this public health risk. All right, this has been Scotty Reed with another Black Talk Radio News commentary. Please support the nonprofit Black Talk Media Project. We are not supported by any other kind of corporate revenue streams. We do have a couple of promotions with a couple of corporations providing services on our website, but those are not major sources of revenue, although we do distribute our podcast far and wide. So this is people-supported radio and podcasting, and we appreciate your tax-deductible donation to the Black Talk Media Project. Peace and blessings to all.